Hey, Matt, great to see you again.
Hey Nathan, good to see you as well.
Yeah, today's topic is crisis and incident response. What are your perspectives on these?
Well, unfortunately, my perspective is you're going to have a crisis in senior care. It is inevitable, whether it is an issue with a resident, whether it is a survey issue, a licensure issue, you're going to run into a crisis situation, and knowing how to respond to it is really critical.
I think you forgot families.
Oh yes, families, families. There's drama in all sorts of places in senior care.
Absolutely. So, what do you think is the best thing to do when one of these incidents occurs?
Well, the first thing we always tell people to do is stay calm. I mean, the worst thing you can do is really lose your cool or run around, kind of scattered thought trying to approach it. They're going to happen. And it's natural. You know, you're dealing with an elderly population, you're dealing with people with a ton of medical complexities or issues, behavioral health, healthcare issues that they have to deal with. And incidents are going to happen. Someone's going to fall, someone's going to have a bad reaction to something. You're going to have an altercation between residents. It is going to happen in your facility. And so the first thing to do is just to stay calm and be ready for it, understand there's going to be an incident, and then engage your counsel. First thing I would say is engage your counsel and start getting your facts together. I mean, Nathan, what would you add to that?
Well, I just want to check you, make sure we're not being self-serving here when we say call your counsel. But I agree with that, and I think it's mostly because counsel can play a really important role in helping the team to stay calm. We as lawyers come into the situation objectively, and on the issue of the facts, I have seen on numerous occasions when we have a crisis situation or a perceived crisis. Sometimes things aren't a crisis at all; they just feel like it. The first explanation of what's going on that I get from the administrator is very different from the nurse. It's very different from the family. It's very different from the medical director. And so what we have to do is really try and drill down. And it's usually that nobody's wrong. It's just they're all sort of seeing things from a different perspective. And so one of the important things that lawyers are trained to do is take complex facts, fold them together, sort of figure out what that Venn diagram dark spot is, and then proceed from there. So yeah, I absolutely think we can help.
Yeah, and I think when we talk about engaging counsel earlier, if you have a license inspection or a survey team in the facility, Nathan, you're absolutely right. They're seeing things from their perspective. They may have talked to one staff member or seen an incident with a resident, and they don't yet know the full background of what has happened and what's going on. And so engaging counsel to step in at the initial stage to help you gather those facts and help you figure out how best to present it to the regulatory body oftentimes can resolve these things before you get into any type of penalties or restrictions or deficiencies of that nature.
True. And another thing about counsel that I want to raise, of course, is that we can bring privilege. We can, our professional rules allow us to make some of the inquiries subject to attorney-client privilege, but please know that all the underlying facts are never privileged. So you can't call your lawyers after an incident has occurred and expect that we're able to keep that kind of stuff, the actual events, confidential. The events are what the events are. You never should be trying to hide the facts. Explaining the facts is a completely different matter. And then I think the other thing, just to keep in mind, one of the best practices that I have always found in my practice and watching great administrators do their job is sometimes you don't have the answers in an emergency or in a crisis. If you let doing the right thing be your guide, you are almost always going to end up in the best legal position. So again, this is where that calm comes into play, is take a moment, try and think, if this were my family, or if public safety, whatever the case may be, if you can figure out and just feel committed to doing the right thing, that's the best answer in every single case.
Absolutely. And I'd like to just add one final thought on my end on this is when you talk about facts and pulling things together, remember, people, we're humans. You have a perspective, you have, might not remember something clearly. So one more thing, make sure you check your documentation. If you're doing your job and you're documenting everything and you're doing the right thing when the incident arises and you're checking it, you can correct a lot of these issues before they really bubble up into problems for the facility.
Great, Matt. This was a wonderful conversation. Look forward to having more.
Absolutely. Thank you, Nathan.